एक बार thank you बोल देंगे.
Thank you, Hindi team. Now we are already 5 minutes.
Okay, you can start.
Yeah, thank you. Thank you so much. And now we are directly moving to the English session. Today's our guest is Dr. Rohit Srivatsan. And today is our 1927th day of continuous webinar. Thank you all the participants for joining with us. Today's our speaker is Dr. Rohit Srivatsan. He's MD in homeopathy. He's working in CR Homeo Research Foundation. And Dr. Rohit is contribute a lot towards the child health, both physical and mental. And he's good counselor, he's good prescriber. He presented papers in many seminars about, temperament, and he conducted a workshop in Dell Computer about the stress management, role of stress management in homeopathy. And he have been treated many cases of ADHD, autism, bedwetting, and many other cases. Speaker of many seminars, presented papers in many seminars. And I'm inviting Dr. Rohit to IFPH forum for presenting your today's session. You're welcome, please.
Yeah, good evening, everyone. Yeah, I would like to thank IFPH to give me an opportunity to present my paper on fibroadenoma of breast. I would like to share my presentation first. Yeah, so without wasting any much time, I would like to say I'm Dr. Rohit Srivatsan. I'm a practicing homeopath in Bangalore. I'm a third generation homeopathic doctor. So I'm practicing at Victory Homeo Specialty Clinic. So which is, in fact, we completed 53 years. So in fact, this year we are celebrating 100 years of my grandfather who started this clinic. So in 1972. And after that, my father, Dr. Srivatsan, and now I've been practicing here since 14 years. So to start with the topic of today, fibroadenoma of breast, let's try to understand a few important things. The introduction. So fibroadenoma is a benign condition in the breast. So specifically, there's a tumor formation which happens in the breast, commonly which affects women under the age group of 35. Now, this is very important. We need to understand the age is very important. So this affects ladies middle age. So it's not an old age complaint. It's not something which happens in a very younger age as well. So middle-aged ladies, they generally get diagnosed with fibroadenomas. I am stressing about the age because as we go through the other slides, I'll explain why that becomes very important in differential diagnosis and diagnosis of the condition as well. And how is this formed? So this is basically a growth which is made up of glandular and fibrous tissue. So we need to understand that this is a solid mass, not like a cyst, which is hollow. And then the clinical presentation of this fibroadenoma would be quite painless, firm, and it is mobile lump, so it can be moved. And often it's discovered accidentally during a self-breast examination or routine screening, that is through ultrasound scans. Now, today's generation, so we're on 2025. So, and I practice in one of the busiest cities of India, and especially the metro city, Bangalore. So here, now today's generation, they're very, how do I put it? The ladies or in general people are very much in specific with their health. So they always would like to go to labs, they keep checking, they go to Google, they test themselves. So all this is something which is very common in Bangalore. So in fact, patients, they sometimes come with a report of their scans and they come and give you the report in hand. Or sometimes they give you a big summary of what they have understood about the condition, what could it be, whether it is cancer, non-cancer, all that they would do an R&D and then come and test the doctor. So very important. Now, as a clinician of the modern medicine of today, now homeopaths have to be, in fact, Hahnemann was, we all know Dr. Hahnemann was an allopathic doctor, then we started homeopathy. So knowledge of medicine, knowledge of proper side and homeopathy has to go hand in hand. Proper diagnosis is very important. Not so That is why our aphorisms, organ of medicine, becomes very important. So he is also stressed very important in the third aphorism, knowledge of disease is very important. So not just understanding the patient, but you need to understand the disease is also very important. So going forward, let's try to understand a little more about the pathophysiology, and then we'll understand how we as homeopaths can deal with this conditions of fibroadenoma. Now, many common misconception people have is any tumor, they would always think it as cancerous. So we need to understand that no, it is not. And when I was also teaching in one of the colleges here in Bangalore, Bhagwan Buddha, for almost close to about 4 to 5 years. I was doing as a lecturer in Department of Surgery, and I did my MD in practice of medicine. So generally, I have a very strong inclination to pathological conditions, surgical conditions. So in fact, I master myself a lot in gallstone cases, fibroadenoma cases, uterine fibroids, chronic kidney disease, which I explained a few weeks back on the same platform. Now, very important is we need to, as doctors, we need to make sure that we explain this. So even this is in fact put in my clinic in a place so that patient can know. So it's just that self-realization is very important. So girls, ladies should always make sure they monitor themselves. So they make sure that this is very important. Now, today's generation, girls are, it's different because of the fast life. They don't eat home food. They're all, today, Bangalore, total Bangaloreans are just, I would rather put 40%, 60% of the population here in Bangalore is completely outside population. And that population, they eat outside. Fast life, survival of the fittest. So there's a lot of constant stress with them. Apart from that, they don't marry early. They are very ambitious, career oriented. So what happens? They don't eat properly. Hormonal variations happen. Oral contraceptive pills. Today, generation is completely different for what things have used to be earlier. People live in relationships. So there are so many things which happens, which make the girl take medications on and off. They take eye pills, they take contraceptive pills, they try to monitor things. It's not going on the right track, but that is why these conditions are propping up too much nowadays. So very important. Every day we need to guide the patients in general or just guide them. This is important to make sure that they do a self-examination. So you can go through this slide. So it's very simple examination. So in case they feel any kind of a discomfort, immediately go for a scan or inform the doctor. So accordingly, things can be taken forward. Now, coming to the pathophysiology, benign tumors caused by proliferation of both stromal and epithelial components of the breast. So here there is proliferation of the stromal and the epithelial components, and then hormonal changes, which is what the root cause why this proliferation happened. Estrogen and progesterone being a main factor, and during puberty and pregnancy time. As I already explained, oral contraceptives are common causative factors over here. And apart from that, many of the time we see mentally the stress, lifestyle. In fact, sometimes we even see sexual life of them. Sometimes there's so much of suppression. So sometimes we see girls, they remain alone, they marry very late, so they abstain from all these things. Otherwise, earlier, ladies, they marry early. Marriage was very early, 20, 25, 26, you're married. By 25, 20, in that age, you would always already have a baby. So everything is changing now. And because of this changes and because of this lifestyle, many a times these mammary glands, there's proliferation. So they have huge, large breasts sometimes. These, and which is very common nowadays. And obesity is very common nowadays. Girls, everyone, there is a part of this population who's very health oriented. So they are into a lot of lifestyle changes. Instagram, they read this reel, they want to make sure they start taking this kind of a diet, they have to start taking this kind of supplements. They're not keeping it very natural, the right kind of food they have to eat, right kind of balance of everything. So because of this imbalance is what causes all this proliferation to happen. And the cellular aspect of this condition, the epithelial cells in the ducts or lobules grow abnormally, forming a well-defined non-cancerous mass and can present as multiple or solitary masses. And very importantly, many of the time, these cases also they come up of fibroadenomas post-pregnancy because of the variation in progesterone going back into estrogen. So in that variation also, very commonly we see fibroadenoma cases. And apart from that, suppression, sexual suppression. Many a times nowadays, there is so much on the mobile that they don't really need a physical person also. But there's so much of suppression, there's so many things which is seen. All this can lead to hormonal variation inside that person, which can lead to formation of these fibroadenomas. Now, investigation is a very key factor in these conditions of fibroadenomas. Ultrasound scan, mammography, CT scan, biopsy, which is the fine needle aspiration cytology, and then PET scan, which we all know we use it commonly for cancer cases to understand the functioning and to understand the size of the tumors and to understand the lymph nodes involvement of the cases where it is going for. Now, many a times for a routine annual scan or in general, ultrasound is a choice because there's no radiation involved as compared to the other scans. And when we now how to understand the diagnosis of these condition, and a simple case of ultrasound is more than sufficient for us to understand and diagnose a case of a breast tumor or a breast lesion. Many a times we would need to understand whether the case is a solid tumor or whether it is a cyst. How do we find out? It's a simple ultrasound and understanding the differential diagnosis. Now, if it is going to be a breast cyst, commonly an ultrasound, you would read it stating as an echoic lesion. And many a times nowadays, the radiologists or in general, what happened, they would always ask the patient to go in for a biopsy immediately as soon as they get a report. And BIRADS classification, which they put, BIRADS very specifically, they would put as grade 1, grade 2, grade 3, grade 4. So it's only when it goes to grade 4, grade 5 is when it becomes suspicious and we think on whether a biopsy is required. But today, with the anxiety of the patient or the doctors in general, they immediately go in for a biopsy to find out what is the diagnosis. Diagnosis is important, but which you can do it with your knowledge of pathophysiology, with your knowledge of understanding the radiology. So an echoic is nothing but breast cyst. It's a fluid-filled cavity and it is also ovoid in shape. Now, very important, fibroadenoma is also ovoid, oval shaped. Breast cysts are also many a times oval in shape. And cysts are more tiny in number and they're also solid because a cyst is very solid, but an echoic. So it would show hollowness, a dark impression which would be seen. A breast cancer would have more of an irregular tumor, more solidified, more hard and increased. And very important, malignant tumors, yes, it can happen in middle-aged ladies as well and elder ladies as well. So this is where your diagnosis becomes important. So because here you're seeing a case of a middle-aged lady who would have in and around in their 30s, not going above 40s. Majority of the cases are in 30s, which you would diagnose fibroadenomas. Then fibrocystic. Fibrocystic changes are non-cancerous, which is seen in the breast tissue, commonly causing lumps and tenderness. So where there is a fibrous tissue and cyst, a combination which would be seen. Lipomas. Now, many a times these are also seen in your ultrasound reports. A patient may feel that there is a lump. It is a little soft. So they can be lipomas in nature. With an ultrasound, you will be able to appreciate it very easily. So this is how we'll be able to understand. And this is what is very important. Now, for a patient to understand, now we need, homeopathy is an art. We need to capture the patient. You need to win the patient. Because today, every road, there are 2 homeopathic doctors. In an area, there are 100 clinics. In a place where I consult, there are close to 150 clinics in an area of about 3-4 kilometers. So that is the amount of competition which is running. It is fantastic. It is excellent for homeopathy. But you need to stand out. You need to stand apart. And how do you do that? Is with your knowledge of medicine. You need to make the patient understand because they think, because when you go to hospital, they would always speak about diagnosis. They would speak about this condition, that condition. You need to be a master of that. When you're a master of that, with your homeopathic knowledge, you can excel fantastic. Next, homeopathy in the treatment of fibroadenoma. Now, our approach, the aim is to stimulate the body's vital force, correcting the imbalance. We need to understand the root cause of the disease, emotional and constitutional aspects as well. Now, this is what I was telling. So, you need to understand the life space. We need to understand how that patient is. What is it that they're doing? So, they would always say they're working. Now, they're working as an IT professional, they're working as a teacher, working as a lawyer, working as an HR. So, this is important. The occupation becomes important. So, you have an idea what this person is, how his timings are. And they are living alone, they're living in a hostel, they're living in with their relatives. It becomes important because emotionally they cannot be as open they are in their hometown. So all this becomes important in understanding, because this is a career oriented woman, or it could be a housewife who has so much of workload when balancing the house, running the show, all that. So very important to understand the emotional aspects of that person. Aphorism number 3, we need to understand the disease in specific. Aphorism number 1, as we are doctors of modern health, homeopathic doctors, and ours is the most scientific, because till date none of our medicines have been banned, or none of our medicines have been questioned ever since Dr. Hahnemann has proved and entered into our Metramedicas. So because every other day the other systems of medicines, the medicines come, they go, they get banned, they get changed. But no, because our Belladonna and Aconite, which was working back then, even works till today. So that is fantastic, and it's evidence based, because every clinic is evidence. So, and it's been running, and everyone is having fantastic results nowadays. Homeopathic treatment process. So initial case taking. So very important as doctors, we need to make sure that we are very patient. Now we need to understand taking the detailed history, physical, mental, then forming a totality. Then aphorism number 18, based on the usual symptoms, the constitution, totality of the case. All this becomes very important. And now many a times now, as I just told you, I'm practicing in a very old clinic. My clinic is one of the most pioneer clinic of in Bangalore city. So there are a lot of cases which come in. So daily I would see about close to about 80 patients on an average. So with that amount of time which I can give to a patient, so what I have to do is I need to be really quick, fast, and make sure that I can hit the right simulum. Many a times, as homeopathic doctors, we need to abide by our principles. But when we read, now when I was a student, when I was doing my PG, when I was reading other therapeutics and other medications, it's always been single medicine. But when you read old therapeutics, Dr. Lilienthal, you read Dr. Davies. So when you read all these books, they speak so much about pathological conditions. So when you read them, Dr. Burnett, so when you read all these books, you get a lot of insight how they have changed medicine after medicine to understand the condition. So it's not that they gave a medicine and they waited for a long time and then change. Today is very fast life. You have to be result oriented doctor. So you have to be a master of everything. So for that, so you have to have different types of prescription handy with you. So whether a strong physical symptoms with particular symptoms of the disease, match it, make a totality, prescribe. Like a 3-legged stool, 3 important character symptoms, enough. So that is how you need to master. Many a times you will not be able to get that time or leverage, or patient may not be in a position to understand that maybe this doctor requires more information. I don't want to say. If the patient is an introvert, will not say. For example, I am a very strong introvert, but when I'm in my clinic, I'm the biggest extrovert. So this happens. So it very, very important that we need to understand the body gestures, how they enter the clinic, how they approach, how they take the appointment, or how they talk to you over the phone. All this is basically an art of case taking. Half of our case taking is done as soon as the patient starts talking. how they present their file, how they start talking, anxiousness. Now patient is very relaxed, cool, like Rajnikant comes and sits in front of you. Typical sulfur personality. Sir, doctor, I am this kind of a person. Theorizing. Boast of bragad. So he would boast about himself. So there are people, it's just that you catch the remedies just like that. And with your knowledge of Metramedica repertory, cross-check. You find out few other things, prescribe. 100% medicine will work. If not, now many a times we will not be able to get the right simulum. For that, what we can do, whatever simulum you get at that time, match it with the medicine and give. And there's another thing, I've been using temperaments ever since right from my UG time. I have a lot of interest on it. So that gives me a cluster of medicines. So I get a personality, match it with the physicals, match it with the particulars, get a remedy, and finish. So there's a lot of mathematics with my art which I do in my clinic. And follow-ups are very important. Many a times it's very important for us to know how to repeat a medicine. Now, there are times where few cases which work fantastic, where that is what I will be presenting later. But that doesn't mean that there are so many other cases also. But there's so many other cases which requires more time for it to heal when we don't hit the right metramedical. Many times we use antimiasmatics, we use intercurrent medicines. So it depends. No, so Sacots, many things are used in prescription. Complementary. Why are all these there in a metramedica if we had to use only single medicine? So it's important that we know everything. So use as and how. And at any given point of time, give a single simple medicine to the patient so that you will know whether that medicine is acted or not. If it is acted, continue. If not, change. Very important. Classification of diseases. Now, like I told you, fibroadenomas belong to the classification of surgical disease. So this belongs to local maladies. Now, surgery can only remove the effect, but not the underlying miasmatic cause. Now, many a times patient of these conditions, they come after taking an opinion with a gynecologist where they would have been recommended surgery. They would say plan a date. I always tell them when it's not an emergency, why do you want to wait? So please wait because the doctor is just making you in a hurry to go for an operation. You have any pain, you have any discomfort, there's no problem, then why? Give me some time, let me see. If I still don't, then go ahead for surgery. Okay. So this is how we need to make sure that you try to look, end of the day, you have to run your clinic. You have to make sure that you're a preserver of health, keep your ethics as well. But in the meantime, try to do the best for the patient. Whatever system. I'm not saying only our homeopathy is the best. Everything is good. It's end of the day, patient has to get better. So that is the ultimatum. Our mission is to make sure patient gets better. So what best we can do at choice is what we can offer at that time. So aphorism number 201, 203 explains how the miasmatic and chronic backgrounds often underlie surgical diseases, and homeopathy helps in treating that root cause. Now, many a times, why I've put this into classification of diseases is very important. So, in fact, Hahnemann has given us how we need to handle and tackle these conditions. Now, many a times, if we don't get, now these are sometimes one-sided conditions of physical category. So, when this comes, and we don't get any medicine or we don't get any much symptom, because fibroadenoma is no pain, just the lump. Nothing much. It's only if you get the simulum with the mental picture, you get the right remedy. Otherwise, what is the symptom on this condition? This is purely one side because there's no other symptom involved in this condition. Patient is very healthy. Everything is update, perfect. So what would you do for this condition? So sometimes we give the closest simulum, then give your antipsychotic, then antipsoric, antipsychotic, antipsoric. So this is what our master Dr. Hahnemann has given whenever we are treating any conditions of one-sided, to open up the case, to understand the miasmatic background. Because end of the day, this is psychotic conditions. So there's extra growth, proliferation. So our understanding of chronic disease is very, very important. So this is how, and all these formulations are there in our aphorisms. So more than enough. So this gives us the understanding of how we have to handle these cases, whether it is it is a case of a miasmatic condition, whether it's one-sided disease, it is a simple acute condition. if it's an epidemic condition, individual case, everything is there in our organ of medicine. We need to just make sure that we use that knowledge immediately and take a call on that particular case. Now, important remedies of fibroadenoma: carboanimalis, conium, condorongo, kali iode, lacasis, phosphorus, phytolacca, sanguinaria, sickle cor, silesia. Now, why at all was this therapeutic brought into the picture? Why did they even make a repertory when, if we had to do only strong constitutional treatment? No, this was brought up is only because it gives you an understanding of common sphere of action. Why this medicine has been grouped? Because most of these medicines have a strong sphere of action on glandular aspect, on the breast, proliferation, psychotic condition, or psychosyphilitic, cancer diathesis, all these. Now, in fact, conium is a very strong glandular and cancer diathesis medicine. Carbonimus also belongs to the same category. Kali iode is a strong tubercular condition, syphilitic condition. Laches is deep acting. So this is a condition which is a very deep condition. And it is not something when you treat a fibroadenoma, you will expect results with the anxiety of the patient that next month, everything will become fine. No, everything takes its time, and we need to understand that step by step, this is a chronic condition. So one-sided disease. So we need to treat them accordingly. Phytolacca. When you read your repertory, it says Phytolacca hard, calcarea phos. He would say as big as a big size for conditions of tumors. Calcarea phos, our repertory in Kent, it says. So all this becomes very important when we are treating these kind of cases. Make use of the therapeutics and repertory. Now, important medical information of medicines which are commonly used for cases of fibroadenomas. Now, calcarea carb are suited for ladies who are fair, flat, and flabby, who have a tendency to form. It's a strong psychotic medicine. Weakness, excessive sweating, sluggishness. Now, many a times you would see these kind of people satisfied, phlegmatic temperament, fair, flat, flabby. And today's generation girls are more or less in this constitution because of the type of fast food that they eat, pasta, pizza, all these kind of things going in, pani puris, all these things adding up, and this is how the constitution also comes up. And many a times because of the psychotic phase, today psychotic is glamour, so psychotic phase is what is running many a time. So this gets into this kind of condition. Then phytolacca. Phytolacca condition is where you would feel hard lumps in the breast, especially pain, breast abscess, breast cancer. This can be used as internal and external conditions. As external mother tincture can be applied to the area, and results have been seen. Look, this is it. If it was not to be used, it would have never been put in our books. So when it has been put in our books, that means there's nothing wrong in using. It is only where you try to say that I will follow only one. No, please don't do that. Always have an open hand, open mind. Whatever comes at that moment, do it for the patient. Make sure you give the best result to the patient. No, I'm going to give one dose. I'm going to wait. No, I'm going to give. There are cases where I give medicine. So I give the medicine, then after that I give the complementary medicine. There are times in between on a weekend I give a anti-miasmatic medicine. Yes, there are things which have happened. There are cases where it requires it accordingly. Now they develop an acute condition in between. So where in acute cases we give an acute medicine, then again go back to the similimum or a weekend. So it can be done accordingly. Conium maculatum. Now this is very important medicine. Glandular cancer diathesis, especially in unmarried old women. Today, ladies are marrying late, or they would have had multiple relationships, heartbroken, grief, bad relationship, leading to emotional stress, lump, conium maculatum. In our Metra Medica, it is mentioned very strong medicine for how Socrates died because of taking this medicine when he was trying this, and then he had the ascending kind of paralysis which happened to him, and very deep acting medicine. And here also it speaks about how the widows, and how they had this breast related tumor, how sexual abstinence in such people where there is suppression, they cannot because either uh, as a widow, or that is how it's written in matter. Now understand that condition and apply it to today's generation. You will use this medicine many a times. Sexual suppression, hard, firm growths, painless, stationary. Thyroidenum, fibroadenomas associated with thyroid dysfunction. Now, today's generation, we see so many thyroid cases. Why? Because earlier it was not being tested so much. Today, every road has 2, 3 diagnostic centers. Every day you will get an ad on through in your newspaper or your mobile or in news channels. Test this lab. Every other lab comes with a package system trying to test yourself. So everyone would like to do that. And now with no GST for our health insurance, so everyone would like to have their health insurance done, which is very important, need of the hour. And with that, they get a package of health check. So with that health check, they come with you with a report, even with small, bold things marked in the hematology or lipid profile or vitamin D. They come rushing to you and see what best you can do at that time. So thyroid cases, I see a lot of cases of thyroid. I do a lot of endocrine cases. So, so menstrual irregularities, PCOD, uterine fibroids is something which I treat very, very regular and successful. Touch wood, I'm doing good in my clinic in practice. Enlargement of glands, especially related to thyroid imbalance. Phosphorus, soft lumps, may be tender, thin, tall, delicate, sympathetic nature, sanguine temperament. Late girls were very bubbly, those Kareena Kapoor types of jab we met. So those are those magnetic nature, phosphorus, always chap chap talkative natures. So those are that phosphorus element. Phosphorus element can be with Barretta phos, it could be with calcare phos, kali phos. So you can have that element mixed with it. Sometimes even silicea also mimics very similarly, very sympathetic, magnetic nature, and they are also commonly seen in conditions of breast tumors. We see Barretta carb, again a glandular medicine, can be thought of with breast tumors with lymph nodes. Lachesis, again, lady closer to the menopause, period of grief, emotional stress, hot flushes. So all these are common medicines. Coming to the first case. So here the case of fibroadenoma treated with homeopathy. So here, this is a lady who had come. So she is an owner of an international school. So she runs a school which has more than 50 plus staff with her, and very charismatic lady, talkative, and she's a people managing kind of a person. So she says that I handle so many people. Doctor, it's so difficult to handle staff, labor, all these things, and I alone. So you can imagine this is a strong lady, career oriented, ambitious, successful. So here, this is very important that we understand the picture, my mental picture. So as soon as she told she's an owner, she's in an international school, running all these things, automatically you need to understand what kind of a person you're trying to treat, apart from the physical diagnosis. So there you get one clarity of that person. Then as we talk, so she was very cheerful, very smiling, and she was very open, very soft natured. When I spoke to her, she told how she was in her college, how she was, in fact, she was one of the uh, leaders of her college where she was the president. And then later on, she and her friend, they started this school, and then later on she took over single-handed and she's running it now since the last 3 years now. So imagine 36 years. This is what we see in Bangalore today. Bangalore, we all know Startup India. So these are those people who are those Startup India people. So she has a history of PCOS. So here we can see there's already some psychosis condition which is seen, bilateral mild. And then she has 2 children, and then the last delivery which was done in 2020. And then she also has this important history of lower abdomen pain, and she has headache on the first and second day of menses, and then flow reddish, leukorrhea before menses. And then Yeah, so she came with an ultrasound scan report of her breast where there was a 6 mm oval-shaped thing, and then the left breast about 3.8 into 3.1 mm in the 11 o'clock position of the, and just oval-shaped. Now here in the this condition, after repertorization, there were medicines like phosphorus, calcareca, naxamica, hyoscyamus, conium, lacustrine, which came. Now phosphorus, why? Because like I told you, I see a lot of temperament in nature. So here it was inclining out of 23 out of 10 symptoms which I have used as cheerful, loquacity, temperament sanguine, tumors, mammae, constitutional, physical, which she is very lean, tall kind of a personality. She desired ice cream, and then mammae, uh, pain before the menses, pain during menses. All these were used, and then phosphorus was selected as a medicine. Now, once I started the prescription of phosphorus 200, so this was given for about initially for about every day morning for about a week, and then followed up with a consultation after a month. So then after the first follow-up, the patient was feeling better with the flow, where she used about 2 to 3 pads. The pain in the breast was better. Again, this pain is just because I had to ask her. Because as I told you, fibroadenomas, that lump will never show any pain unless you really press it really hard to feel. Only then she would. Anyone with a fibroadenoma, 90% of the cases would never have any pain. So this is those general discomfort in breast, which many girls have that. And very important when we take cases of trying to understand the menstrual cycle, or when we treat the dysmenorrhea cases, we need to understand few important characteristics. So try to understand what are the indication symptoms. Patients speak about PMS. Doctor, I have PMS. What is this PMS? You ask them, then they will say, oh, I become very irritable, I become dull. So you need to understand. So that is how they open up. So try to catch those symptoms. So that becomes important for us to understand, so that through that channel you can enter into that patient, where you can try to learn a little more about them, how they are, and all that. And then repeated doses of phosphorus was given, and then menses flow got better. Headache was mild, but had nausea during her menses. Again, a further follow-up was where I continued phosphorus, but here I increased into phosphorus 1M. And then after so she was feeling better, then I added the next power of phosphorus 10M. Then again, I advised her to go for an ultrasound scan. So here there was no fibroadenomas which was visible in this case. So this is very important. So she was under the BIRADS category 2. There was no lymph node involvement. Now this is very important. Lymph nodes, very important, is understanding whether the case is going over to cancer or not, or in general lymphadenopathy is important. So, and when lymph are involved, then it goes into third category. So that with your medicines, that also should start getting better, because they are the drainage system of our body. So that is what is important to treat. And so this is one of those cases. So like there are many cases. So many cases we use so many other medicines, and so many biochemic medicines. So calcarea flow, calcarea sulf, calcarea phos. So there are so many times these tissue remedies help in cases where I don't get the minimum. So until I get something really strong, these are medicines which are used at times. Then this is another case of a artist. So she's a uh, heroine. So she's an actor. So she, 37-year-old, with a firm hard lump in the right breast. So painless lump felt by the patient. And then on palpation, there was no pain and lump which she has expressed. So now why I have mentioned here is past history of aerobic 6 months back injury. Yes. Many a times, as I told you, there's a many a times a one-sided surgical cases. So you need to try to get as much information as you can. What happened? Did you get hurt? Was there anything else which happened? So all these becomes important. So major times we forget to ask these things. So when I asked, there was a vague memory in her which said 6 months back I was doing my workout and I slipped and I fell on the floor. I fell over, facing the floor. So she felt a slight pain. Again, it's not something which she says that it could be related. Again, I made her think that way. I asked her, how long was that been? So that is how I tried to understand whether this could be a reason of injury related to proliferation, relating to formation of fibroadenoma. Could be, could not, but this helps in homeopathy. I'll explain you later. One child, and then the last delivery was 2018, and mild constipation, thermal chilly. She's an introvert and not very open up, like how the previous lady was a very strong case of sanguine, very open natured. She was very introvert, only to the point speaking. Uh, Very talented. You can understand she's an artist, so she has to be talented, multitasking, so intellectual. So you can understand all these. So you need to. It's just that when you understand the profession, when you understand that person, automatically the rubrics have to come into your mind. Now, as soon as you see artist, so there has to be some talent. When there's a talent, there has to be intellect. Otherwise, they will not be able to deliver the dialogues. Remember so many dialogues, enact it. So all these things have to come into your mind immediately. So again, it's not that you need to ask the patient. How will you ask the patient? Are you talented? Are you smart? It's not. It's just that assessing. It's just you have to scan through things, and that is how you capture rubrics. So this is how we need to make our prescription stronger. So here, this was a case where the size of the fibroadenoma was 1.2 into 1.3 centimeter, which is a 2 o'clock position. She had already done an FNAC, so it was a fibroadenoma of breast, and no malignant cells were seen. So this was because she had already consulted the doctor. They and the lab insisted that she goes for a FNAC because it was a 1 centimeter solid mass. So then for this, I selected conium mac. Why conium mac? Now, conium, when you open conium under Clark, Clark is my source book, which I use in my clinical practice most of the time. I mean, of course, I use Boric and Allen's as well, but Clark is my go-to book. So here he says under the causations, contusion, injury, all these are very important. So using that information, her mild nature of timidity to an extent or introvert nature, hard lump. Again, we all know conium is a very strong glandular tonsil, lymph nodes, any fibroids of any kind. You can always use conium max. Conium max is a fastest, very fast prescription. Conium is in fact today now winter season. It's the climate now, and then cold weather. So coldness in the throat, cough. Conium works fantastic in acute conditions. In fact, fast prescriptions are conium, throat related. So here in this case, so first prescription conium mac was given for about 6 days, and then the patient generally, but well, like I said, there's nothing much symptomatically, so I continued the prescription and went on for another month. Then I asked her after 2 months to go for a scan, and here I did see there was a mild decrease in the size of the fibroid, and then the patient was I again administered conium mac 200. Now I am a person who uses majorly 200 or 1 m and 30 potencies. I'm not so much into millisiemens scale potencies yet. And generally, since these are physiological conditions, so I generally tend to initially start always with a 200, or sometimes where there's nothing, I go for 30. Then over here, as months pass by, I continue the prescription of conium, wait, and then after further follow-ups, um, the patient getting better. And then the last scan, which went through in the month of April, the patient had no hypoechoic. Now, as I told you, hypoechoic lesion, now very important. Now, like I said earlier, this is very important. So, lobulated, the very important condition. So, hypoechoic means solid, fibrous, related growth tissue, glandular, fibrous is what is hypoechoic, or they would mention only echoic. And anything anechoic is cysts, and breast cysts are very common. Many a times in we treat cases of breast cysts with same conium, silicea, calcarea carp, apis mellifica, calibrome. Um, so these are, and tuja of course, and these are common medicines which we can use for breast cysts. But fibroadenomas, a little more deeper acting medicines are required in treating. And apart from this, like uterine fibroids, even these fibroadenomas, if left untreated after menopause, they would shrink a little and regress. So many a times when we are treating cases uh, of ladies who have already attained menopause and with fibroadenomas, you give medicine, you see she would have attained menopause, and then you say, oh, this it's reduced. No, it's not. The pathophysiology, the pathology, so the physiology of the case is it is reducing. It's not that the case hormonally regresses. So that's very important that you should remember. These are hormonally driven. So it's only the reproductive phase. These fibroadenomas or uterine fibroids, they increase in size. Aphorisms, we have to be unprejudiced observer. Try to keep as much as no conceived ideas about the patient. Though I told you that you need to be fast in assessing the patient, that is very important. Then signs of commencing improvement in between aphorisms 256 to 250 to 256 gives us that information of how the patient is improving. And my conclusion would be fibroadenomas can be effectively treated with homeopathy, focusing on holistic care, individualized remedies, addressing underlying causes. Here I've just presented two of my cases. There are many cases which we treat, but like I said, it was why I got the right medicine, the right cause of finding out, and that's how these medicines have helped. Now, conium we use in many other cases also, but in those cases, the result takes its own sweet time. We need to be a little more patient. Maybe we might have to change few medicines. As I told you in the start, also I have to use miasmatic medicines. I use tissue medicines, or sometimes mother tinctures are used. But at any given point of time, give one medicine at a time, see the action, then use something else and observe and treat. So this is how I have to, and I've been practicing in my clinic, which I've learned from my father, Dr. Srivatsan. And I'm continuing the legacy of my clinic. Final aphorism number 12, disappearance of totality of symptoms by the cure, the affection of vital force, the whole internal and external morbid state is also removed. Thank you all for your patient hearing and giving me this opportunity. I would like to thank Dr. Anjani ma'am, Dr. Danesh, Dr. Sani sir for giving me this opportunity in this very wonderful portal for expressing my clinical views, my clinical practice, my experience. Over to you. Thank you so much for your patient here.
Thank you, Dr. Rohit. Really wonderful session. You have taken the courage to treat such cases. Thank you so much for sharing your experiences here. Doctor, I have a question. In these kind of cases, fibroadenoma breast, we are more concentrating on pathological symptoms, right? No need of going behind the constitutional medicine and all, right?
It's if we get the constitution, it is always the best. Many a times we don't get it because patient will not say anything because they also know there's no other symptom. That's why we put this category as one-sided diseases. That is why even in allopathy, these come under the surgical category. So that is why we use organ and that's why we give antipsychotic, antisoric. So this is how we try to open up the case better and better, and that also helps.
Yeah.
Chronic disease, because these all come under the chronic conditions. So this is what I have learned as a UG student. My organ professor is teaching me the formulations, how you have to use. I have always used to think, okay, let's see. But sometimes it's true, we don't really get much symptoms in these conditions because there's nothing much, because it's just a lump which is there, and patient also accidental finding. There's no pain, discomfort, no health, illness, nothing. So,
yeah.
And if the patient opens up, they give us more of their mentals, it's our benefit, so we can get a better medicine. or sometimes we are busy, we are ignorant. I would always put it as us. We, because it's always the drawbacks is with us, because homeopathy is always very big. The limitation is with the doctor. So if I get something, it's my plus point. If I don't, whatever best at that moment I do.
Thank you, Doctor.
Yeah.
Dr. Danesh, you can ask.
Dr. Rohit Srivatsan, it's really an excellent session indeed.
Thank
And
you.
as you suggested, it is better to practice the way you practice. That is what there was a session on that by Dr. Hari Kumar in this forum. His presentation was like this: practice yourself the way you like. Because homeopathy is such a wonderful system where you can go along with the same practice what you are doing, but you can add something more from here and there. That's what we have to do to be a better practitioner, even though that does not take you from leaving the fundamental laws, but you can stick on with the fundamental laws and you can go ahead in that way. Last time there was a question from me about there was a patient admitted in a hospital where the condition she is having hypoglycemia, and in between the chat, your father, Sivasan sir, has told that gave strychnine 30. Yes, I have given to the patient the strychnine 30 along with the Natramo 3X. It works wonderfully, and the patient is recovered so quickly than expected. And everybody in the family was very, very happy. That's
Fantastic.
what I would like to add, because this kind of transformation of knowledge from seniors to juniors and from one to one, whether it be a junior or senior, it doesn't matter. What matters is the content and the knowledge and the experience. And you have shown, you have well demonstrated your power of knowledge, as you have. What you got from your father is something that nobody can say that it is something less than what you can get from God. That's what I that's what I have noted in this session. And as you rightly point out, fibroadenoma, whatever be the cancer, at any stage, a homeopathy can treat the patient if you know what is what and how to move forward. And whenever you get a doubt, you can just call your senior or a junior doctor to know how he practices. So that's what I would like to add to you. Anyway, congratulations. Hope we can have some more presentations as per your convenience later.
Fantastic. I'll be honored, sir. Thank you so much, sir.
Thank you, Dr. Danesh.
Dr. Sarbi is waiting.
Who?
Dr. Sarbi from the lounge. She can say auto thanks. Dr. Sarbi.
You can
Yes,
call
yes,
her.
yes. Dr. Sarbi, please unmute. You can. Okay.
Hi, thank you so much. It's a wonderful session again. And Dr. Rohit and their family is wonderful, has experience. And I am happy to hear all of that. And I want to ask you, what did you think about the mammography for breast cancer or fibroadenoma causes? And the others, what did you think? The 40 age woman and unmarried and very business oriented, and they had fibroadenoma and the uterine myoma. What did you think about firstly? Thank you so much.
Yes.
Now we have to move to the Malayalam session. Dr. Rohit, we are so thankful to you for your wonderful session, and come again. We are eagerly waiting for your next class. Thank you so much, and good night.
Yeah, good night. Thank you.
Thank you everyone for your participation. Thank you so much. And now we are moving to the Malayalam session. This is the end of our English session. Tomorrow we'll see the same time and meet you again. Bye bye. I'm inviting Dr. Shaila for moderating Malayalam session. Doctor,
Uh,
you're
the-
welcome.
There is an announcement for tomorrow. Tomorrow we will have a session from Dr. Divya Radhakrishnan, and Doctor will be talking about understanding materia medica and case taking through levels of experience. Thank you.
Thank you, everyone. Dr. Shaila, you're welcome.
Thank you, Dr. Ajini Maliyakal. എല്ലാവർക്കും